Welcome back to Navigating Cancer. I'm Wendy Hall from the Robert Boisnot Oncology Institute. And remember, if you have any questions or any ways that you could use our help, then you can call me at 527-0106 and we'll find an answer for you or help you in any way that we can. So 527-0106. And joining me today is Gail Kostelnick, and we've been talking about colonoscopies, colon cancer. She's a nurse and worked many years in endoscopy. And people think of colon cancer, and there's also anal cancer as well. And I don't know if you can comment on how all that goes together. It's colorectal cancer, and then anal cancer is a little bit different because anal cancer is characterized as skin cancer, same type of skin cancer, just on the inside. So the treatments are similar, but it is a little bit different as far as pathology-wise. So
and
as far as symptoms and things, it would be some of the same symptoms?
Could have some of the same symptoms. A lot of people have described a feeling of fullness. 50% of the patients will present with bleeding, a little bit of bleeding, sometimes a lot. A feeling of not really emptying after a bowel movement, changes in the bowel movement as becoming thinner, and just a feeling of something just really isn't right down there. And many times it's attributed to a hemorrhoid, and some people's treatment has been delayed because they've had a doctor tell them, don't worry, it's just a hemorrhoid. So that's why I stress that you really do need to have it looked at.
Yeah. So is how are you diagnosing with anal cancer? Is it the same as far as colonoscopy?
You have to visualize the tumor and get a biopsy and send it so the pathologist can determine exactly what kind of cancer it is, and then you know how to treat it from there. And typically it is chemotherapy and radiation together, and it's fairly brief, 6 to 8 weeks. And
fairly brief. I love that.
Well, compared to others, it's fairly brief.
Yeah.
Yesterday I was 8 weeks since my last final treatment, and I feel great.
Yeah.
So
wonderful. Yeah, when you're, I'm on the radiation side, as you know, so when you're coming in every day, and once in a while patients have to come in twice a day, then it's like going to work again. It's your job. And really, it is your job to get healthy again. It's a full-time job to get yourself through this and do all the things step by step that need to be done to be healthy. And you're a perfect example of that.
Yeah, you do have to take responsibility, and I know it's very difficult. You know, Farrah Fawcett brought this cancer to the forefront.
This is the anal cancer.
Yes,
yeah.
And unfortunately, her death was very tragic. Her family hasn't been forthcoming with a lot of information, but you sort of hear through the grapevine that she didn't really seek aggressive treatment in the beginning. But we don't really know what her situation was.
But the sooner the better.
Absolutely.
And
sooner the better.
If you're having any symptom at all, then you want to deal with it right away and not wait, and not assume that it's just hemorrhoids, even if you've had hemorrhoids before.
Correct.
And not assume that if a doctor's saying, and you've never had a colonoscopy recently, not assume that it's just hemorrhoids because the physician may say that. Because it can be a lot of the times, but if it's not, then I need to know that.
Right, absolutely.
Yeah.
Now, Wendy, if someone doesn't have insurance, and there may be someone out there who's worried that they don't have insurance, and what can they do? I'm certainly hoping that they wouldn't just arbitrarily be shunned from treatment.
Yeah. If they don't have insurance, then we have to work at that, and I'll help them work on that.
So they can call you for help.
They can call me at 527-0106, and my doctors will also help. And there are some resources, and there's ways to navigate the system. It's not as simple as, I don't mean to be disrespectful as far as saying it's simple, because I know it's not simple, but it's a little bit harder to navigate, but it can be done and it should be done, and the sooner we get started on it, the more successful we're going to be. Right. And that's the problem. I find that we have people that knew they were having some trouble for a while, and if they don't have insurance, then it goes on until it's a catastrophe. And so that's the earlier that they're screened and we can deal with the problem, the better their success rate is. Yeah. Now, anal cancer, there's some sort of connection there with HPV. I mean, I hear a lot about that. Do you have any?
Yeah, that's been a lot on, it was on Katie, the doctors have done a segment on it. They're finding out HPV, there's over 150 strains.
And HPV is
It's human papilloma virus.
Okay.
And it's thought that 80% of the population has it. Now, it's something that can come and go and your body can fight it off and you can never know that you've had it. Typically, when a woman goes for a GYN checkup, the doctor will test for it then. In my case, it was always negative. Now, the tumor can also be tested. I didn't know to ask that question. So it wasn't done.
Would it have made a difference?
Well, the only difference is that had I known that there was HPV there, HPV predisposes you to other types of cancer, cervical, ovarian, and that kind of thing. And so it would just be a little bit more attention on my part. But 80% supposedly of anal cancers are caused by HPV, so I'm hearing. And that's why that vaccine that they're recommending be given in the teenage years.
And I've heard the doctors talk about that they're fully in favor of, the young people getting that vaccine.
They're doing studies now. Of course, it's going to be a while until they're all done, but it's showing great hope in preventing this. And I can tell you, had it been available to me, and I would have known that it would have been something that prevented a chance of having cancer, sure, I would have taken it. Just like I always get a flu shot to hopefully avoid getting the flu.
Now, if the ladies are going to their annual appointment and they do the blood work or the testing, for instance, I can say I've never looked at it or known if I had HPV or not. I'm clueless. Do they let you know, or would that be the standard practice if you do have it, even though you're not having any problem?
They should let you know. Actually, I had no idea that I was being tested. I called my gynecologist when all this came about, and he said, "Oh, I've tested you every year."
I'll be darned.
So it's something that you want to make sure you ask when you go for your GYN checkup. There's really not a routine test for men, though. This is just one of those things that it's really very prevalent, and it causes a lot of other cancers. Michael Douglas got a lot of
publicity,
yes, publicity from
because of his neck,
which turned out to be tongue cancer, but that's his story. So
or whatever. He seems to be doing well now, though. So
right.
You know what? I can't thank you enough for coming, and if you're going to stay with us, and we're going to come back after this break, and we're going to talk about maybe some tips and some ways that you were able to keep yourself focused and organized, and we'll talk a little bit more about your ideas.
I'll be happy to.
Okay, we'll be right back again after this break.